Hello and welcome to vlog number 125. This week, at the request of YouTube user Marek Felinsky, I'm going to talk about bladder problems in Parkinson's disease. Parkinson's disease is an incurable, progressive neurological disorder. Many people with PD suffer with genitourinary dysfunction such as urinary incontinence, which is the inability to hold urine, urinary urgency, urinary frequency, nocturia, which is a frequent urge to urinate during the night, and difficulty in emptying the bladder. Bladder problems can be very embarrassing and may have a significant impact upon quality of life. A review of urinary tract dysfunction in Parkinson's disease by Yo et al. States that nocturia is the most common complaint, with over 60% of patients reporting it. Urgency is reported by up to 54%, whilst frequent urination is reported by up to 36%. Overactivity of the detrusor muscle, which is responsible for the expansion and contraction of the bladder, is the commonest dysfunction in patients with PD. The lack of dopamine and resulting interruption of signals from the brain can cause the disruption of messages that tell the bladder to retain or expel urine. An increase in the frequency of urination can also be age-related, because as we age, the capacity of the bladder decreases, or due to other causes such as a urinary infection. Urge incontinence is the most common form of urinary incontinence in Parkinson's and is characterized by urine leaking before getting to the toilet because of involuntary contraction of the bladder and relaxation of the sphincter muscles. This is more common in the later stages of PD, so urinary urgency in the early stages should be investigated, since the cause may be unrelated to Parkinson's, or may be due to another form of Parkinsonism, such as multiple system atrophy or MSA. It is well recognised that patients initially diagnosed with PD may in fact have MSA, and it's important to distinguish between them. Stress incontinence can be experienced when coughing, sneezing or laughing because of weakened sphincter and pelvic floor muscles. If the bladder is unable to empty properly, then this can result in the build-up of urine and eventual overflow incontinence. Some people with Parkinson's have difficulty in passing urine because the bladder fails to contract when required, or because the sphincter muscle fails to relax, or because of a combination of the two. This is due to a reduction in levels of dopamine, which interferes with the action of the bladder muscles, causing the retention of urine. This reduces the amount of urine that the bladder can hold before it needs to be emptied again, resulting in increased urinary frequency. It is important to discuss any bladder problems with your doctor so that they can be assessed and treated if appropriate. Bladder problems can occur for a variety of reasons, so your doctor needs to eliminate causes other than Parkinson's. Treatment may then include advice on drinking and diet, the adjustment of Parkinson's medication, the prescription of medications to improve urgency and frequency problems and reduce urine production overnight, and pelvic floor exercises to strengthen the muscles involved in bladder control. In Parkinson's, many incontinence problems are caused by difficulties in the practicalities of going to the toilet, and there are a variety of ways in which these difficulties can be overcome. For example, grab rails to facilitate the use of the bathroom, clothing that is easy to undo, exercises to train your bladder to hold on for longer, and the use of incontinence aids and equipment. It is important to drink around 2 litres of fluid per day to ensure that you don't become dehydrated, but restricting fluid intake in the evening, particularly in the hour or so before going to bed, can help with nocturia. Drinks containing caffeine can irritate the bladder, as can alcohol, so it makes sense to restrict your intake of such drinks. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.